Hi, I'm Lina Ya'qoub. I'm one of the fellows at Louisiana State University. I'm excited to be here at the AHA 18 meeting in Chicago. We're joined here with Dr. Gregory Piazza. He's one of the assistant professors at Harvard Medical School and vascular cardiologist at Brigham. We're excited to have you here. Thanks for being with us.
Oh, thank you so much for having me join you this morning.
Great. Can you, sir, tell us more about the exciting trial that you've been working on, the AF Alert trial, and how you got involved in that trial?
Absolutely. So the AF Alert trial is something that actually has been probably a decade in the making. So when I was a cardiology fellow, I came over to Brigham and Women's Hospital from Beth Israel Deaconess to join a K-12 funded vascular medicine training program at Brigham. And I had to pick a mentor, and I had to start doing research because that was one of the requirements for the fellowship. And this particular lab, the Thrombosis Research Group, had done a study called the Electronic Alert Trial, which was a computerized decision support alert that helped to identify patients who were hospitalized at Brigham and Women's Hospital who had a high risk for DVT or PE but weren't getting prophylaxis. And it was a randomized trial, so half of the patients got notified to their providers that they were at increased risk for DVT or PE and that they should get prophylaxis. And that study actually showed a 41% reduction in symptomatic VTE. So it was a big trial, a kind of landmark study when it came out. It was published in the New England Journal. We did some sub-studies looking at different ways of tweaking that, and as I progressed from fellow to faculty, I started to think about how else could we apply computerized decision support. And just perfectly around that time, the direct oral anticoagulants were coming out, and there was a lot more attention on underutilization of prophylaxis for stroke in atrial fibrillation patients. So it kind of seemed like a good fix. We've got this tool that you can use to educate providers on the fly about their patient's risk, and to use the provider order entry mechanism as a sort of teachable moment. You could give them an alert that brings them up to date on the guidelines in a very short amount of time and encourages guideline appropriate standard of care. And so we conceived of doing a decision support study, looking at stroke prevention in AFib. We were able to get it funded. We called it the AF Alert Trial, and we were able to execute it, although it wasn't the easiest thing to execute, because right as I wanted to launch the study, we switched to Epic. And the hospital really didn't want to do a lot of research studies around the clinical launch of a new EHR, but we were able to convince them, and they were awesome supporting us. And so we were the first study at Brigham to actually use Epic for a research study. And it turned out to be an incredible experience because Epic is fantastic at enrolling patients and identifying patients for the study. And so we conducted the AF Alert study. It was focused on 458 patients who were hospitalized at Brigham. These were patients who had a CHADS-VAS score of at least 1, and that was based on the ESC guidelines at the time we conceived of the study. And they had to have AFib. And if they weren't prescribed anticoagulation, then there was a randomization to either have their provider get an alert or no notification for the control group. And it's pretty exciting. We were able to show that the alert tripled the prescription of anticoagulation in these patients during the hospitalization, at discharge, and also at 90 days. So there was sort of a persistence of the effect of the alert. What we didn't expect to find, and which was a pleasant observation, is in patients in whom the alert was sent to their providers, there was a reduction in stroke and myocardial infarction that led to a kind of dramatic reduction in a composite endpoint of death, stroke, MI, and systemic embolism.
These are amazing results, really very impressive work. For more videos like this, please follow us on youtube.com/fitsonthego.